Hello, everyone. Welcome to the 100th episode of DocTalk. My name is Brittany Hollerback. I'm usually behind the camera, but I stepped out front today to welcome you guys and just say a big thank you to Dr. Augustine, who has been keeping us up to date with all the latest in fire and EMS health and safety and keeping you guys healthy and safe on the front lines. So I will turn it over to Dr. A for our 100th episode.
That is incredible. Brittany, thank you. Brittany's been the producer, editor, the mind and brain behind this since it started. And thanks to her, and thanks to Sarah Jenke and the other people who have supported this since the middle of COVID days, 5 years out. Next month will be our 5th anniversary of COVID, which allowed us to really begin to think through Zoom conferences and how to get information across in social media much more efficiently. But Brittany's been the brains behind this. Brittany, thank you. And we'll go for another 100 that hopefully is successful as this one. So here we are in the beginning of March, thank goodness. And that palm tree on my plate here reflects a lot of people coming to Florida and a lot of people thinking about warm weather, as they should. It's been a really rough winter in much of North America. And so we're almost through it. We got a couple more infectious disease things to get through first. So that's what we're going to talk about today very quickly. We don't have COVID to talk about. That's a good thing. And again, as we approach 5 years, remember, we've lost millions of people to that terrible disease. It has changed a lot, and it has made us conversant in infectious diseases, which is a good thing. Our two diseases to talk about today are timely, and I got a bunch of requests to talk about walking pneumonia and double pneumonia and what is pneumonia and how should I be concerned about a family member who's got pneumonia or when the doc tells me you've got pneumonia. So I got to tell you the first thing, pneumonia is pneumonia. Pneumonia is an infection within the tissues of the lungs. Essentially, all pneumonia is on both sides. And so every pneumonia, if you want to think about it, is a double pneumonia. Double somehow a long time ago began to refer to pneumonia that was on both sides. And that related to whether on an x-ray you could see fluid on one side or both sides. In reality, all pneumonias are on both sides. The second thing is walking pneumonia has nothing to do with whether you can walk or not. And so walking pneumonia is a bad term. So if your doc says to you, I have pneumonia, you want to ask two things. Doc, do you know what is causing it? Is it a virus? Is it a bacteria? Is it another kind of organism that you're suspecting? If I'm really sick with a bunch of other diseases, is there something really bad causing my pneumonia? That's what's really important, is what is the bug that is causing it? And for those who are familiar now, the Pope is very sick with a pneumonia that's caused by likely a bacteria that is resistant to a number of other antibiotics. And that's what's made the Pope's course so difficult and why he has been struggling to recover from pneumonia. That doesn't happen to everybody, very honestly, but there are some bugs that are really bad when they get into the lung tissue, and they can cause people to die, which happens every once in a while in people who are otherwise young and healthy. The second thing you want to ask your doctor is, how are my lungs affected now, and what do I have to look out for? And then you can have a discussion with your doctor about how well you're breathing, if you're able to breathe when you're doing some exercise, because one of the ways that in healthy people, we know their lungs are heavily affected is we ask them to walk, like walk the hallway or walk into the other room and back. And if they're really short of breath, when they get back, we say your lungs are significantly affected. And at the point where you can't do any kind of exercise without getting short of breath, that's a time when you think about putting somebody in the hospital and treating them much more aggressively. In many cases of pneumonia, you're coughing a lot. You feel terrible. You're running a fever. You have chills. And you may have some other things in certain types of pneumonia, like nausea and vomiting, ear infections, a sore throat, soreness in your chest from coughing so much. those are not as bad as symptoms as how well are you breathing. So how are my lungs functioning is your second question. So pneumonia is essentially all double pneumonia or an infection on both sides of your lungs. Number one question, what bug is causing it? Number two, how are my lungs doing through this? And then it's a discussion about how to treat it, how you should expect to recover, which typically your doc will tell you 6 to 8 weeks, and you'll be coughing that entire time. And the cough is good, as we have talked about before. And the cough means that you're getting stuff up out of your lungs. The only way to clear your lungs is for you to cough the bad stuff out. All right. So that's pneumonia. The second topic for this month is measles. And that is because in Texas, we now have a very significant measles outbreak that is occurring amongst mostly unvaccinated people. And unvaccinated people have no protection against what was a deadly bug when I was still a child, and we had no vaccines, and people got very ill with measles and also mumps and rubella. So that's the MMR vaccination that became part of our usual pediatric lingo about 40 years ago. Essentially, all American children got the MMR vaccinations when they were too young to remember or know about it. And they protected us and almost wiped those diseases out in America. Now we're having these outbreaks, and they relate to people who are not getting their vaccinations, particularly children. And this week we had the first death from measles. Measles is a systemic infection that begins in the respiratory tract. You protect yourself from measles. Recognizable pieces here. Here's the N95 mask, and the N95 is what protects you from all of the bugs. We have a surgical mask here, which does some protection, but is mostly about keeping people who are sick from coughing that out into the air. So this is not as good a protection for you. What you want around somebody who's really ill on yourself is an N95 mask. So N95 masks protect you from the spread of measles, and that is done through the air. Measles comes on as a fever, a little cough, a runny nose, and occasionally some irritation, so some redness around the eyes. That goes on for 2 to 5 days or so. And then we get the real classic symptoms of measles, which is a red rash beginning around the head area and going towards the toes. So measles starts in the head, it starts at the top and goes to the bottom. With that, oftentimes is a worsening cough and the fever, which may come and go as this person has been ill now for a few days. That rash usually lasts for 4 to 5 days. It can get very uncomfortable for the child or other person who has it. If this happens in an adult who's unvaccinated, there are a number of very bad things that can happen to adults who get measles. In the cases in Texas, they're mostly in children, and one of those children did get one of the horrible manifestations of measles, which is an infection that goes into the bloodstream and around their brain, and that child died, unfortunately. So that's the headlines on measles. It is a very infectious, one of the most infectious diseases that there is, with a prodrome or a time between exposure until you get the disease that is long. It's usually 8 to 12 days. And you're infectious from about the time that you start with your symptoms that are minor: fever, little cough, little runny nose, maybe some redness around the eyes, and then the rash comes. And so typically we tell people that measles can spread 4 days before the rash and 4 days after the rash. So more than a week that this person is infectious to others. When others are around, they all have to be vaccinated, and it's a really good idea to wear a mask. We believe that once you get immunized for measles, you have lifelong protection unless something has knocked your protection out for some reason. And typically those people get re-immunized because this disease is bad in adults. Measles, mumps, rubella are all bad. So, for example, one of my family members had a really bad cancer. They had their entire immune system knocked out by a transplant of cells into their body, and they had to re-immunize my family member for all of the childhood diseases, including MMR. So, measles, pneumonia, two timely infectious disease topics. We're closing in on the end of winter. Hopefully, the influenza A is going away. We're going to watch very carefully because this same influenza bug in 2009 had a big outbreak in the fall again after we had it in the winter and spring. So we're going to keep an eye on that. In the meantime, you all should look for warmer weather, better times ahead. We'll start talking about summertime drowning, which we've had a lot of here in Florida as the visitors have been here, unfortunately. And we'll talk about the hot weather stuff that we really, frankly, love to talk about rather than pneumonias and measles. So stay healthy. Let's get into the warm weather. Enjoy the last of winter. And these longer days are just beautiful. So Doc Talk number 100. We're done. And thank you, Brittany. And thanks to all of you who've been listening all these years. Take care of yourself.
Thanks, Dr. A.